Thank you so much.
Thanks, Linda. And thanks everyone for being here today. And thank you to the organizers for inviting me to present on behalf of the Gerontological Society and the National Center to Reframe Aging. So I'm going to share my screen with some slides to help guide our discussion. Are you seeing the right slide? You're seeing the actual presentation, right? Not my notes, right?
Looks good.
Okay,
Correct.
good. It's hard because you all know we're all on Zoom and how this changes for us. But as Linda shared in my bio, when we talk about reframing aging, we are talking about improving how people think about aging, which contributes to how we can get program and policy support for aging services and programs. And so why this matters is as leaders in aging, as leaders on your campuses, in your communities, you have a great deal of influence with friends, colleagues, students, and our words that we use matter, right? It really does matter how we publish, if you're interviewed, when you're promoting a website, how we talk about aging is really going to make a difference in how the public perceives aging. And so we can start to advance how those internalized or those implicit biases that we have about aging, we can start to change that. Now, this initiative is conducted on behalf of 10 aging organizations, national organizations. You should recognize hopefully at least one or two. I heard GSA mentioned and AGS mentioned a couple times today. Mike's here from AARP, but also the American Federation for Aging Research, American Society on Aging, Grantmakers in Aging, Leading Age, National Council on Aging, and the National Hispanic Council on Aging, along with US Aging, are part of this. And what happened was the CEOs of the organizations get together from time to time, and in their conversations realized that one of the stumbling blocks that we have to advancing aging issues are our policies and programs that we cannot get it across the finish line to get policy supports. So decided to, with support from our national funders, Johnny Hartford, RRF, SCAN, and Archstone Foundation, along with some local and regional partners, decided to partner with the Frameworks Institute. And I'm not sure if everyone's heard of them, so just briefly, they're a national think tank their mission is to give social change efforts the tools to reframe those issues. So they conduct the research for what would it take to change that dialogue that we have. Now, one thing I want us all to remember is that, and sometimes when I'm in a presentation live, I'll say something like, if you're not aging, raise your hand, right? So we're all aging, right? Aging is not a problem that needs to be fixed. We are all aging. It's not a disease that needs to be cured. Right? It's a natural, lifelong process that unites us all. However, we know that we have been bombarded with messages from a very early age that drive how we think about aging. And so it's nothing for us to hear people make jokes, watch television shows that exaggerate sometimes disabilities as we age. And we've definitely seen the advertisements for anti-aging, whether that's food, whether that's cosmetics. Those things start to impact us. And I think one of the biggest places where we see it is birthday cards, right? Nobody thinks twice about sending a birthday card that makes fun of age. And if you look at the card that's up on the slide here, it not only makes fun of age, it makes fun of someone's disability as well. These seem like they're minor incidents, but what really starts to happen is that drives how we think about aging and how we make those split-second decisions when we hear about aging. Colleagues at University of Michigan conducted a national poll on healthy aging, and they examined older adults' experiences with everyday ageism, and they surveyed people from age 50 to 80, right? Overall, 82% of adults regularly experience one form of ageism in their day-to-day lives. So that could be interpersonal, that could be internalized, right? What I think about myself about aging. And that could be the messages that we're exposed to, sort of like what I was just saying about watching television or seeing something on, or where we talk about the birthday card reference. What we learned through our research and what I really like to share about the Reframing Aging Initiative and the work of the National Center is that it is evidence-based and it's research-based. What we learned when we interviewed members of the public about their thoughts and their assumptions about aging was, well, first of all, ageism wasn't on the radar screen. It's not considered a problem. People tend to not understand the consequences of ageism. And I'm going to talk a little bit about this in some subsequent slides. And that ageism is a lesser ism, and it doesn't need to be a priority. Now, what I will say is what we talk about is we experience all of this in an intersectional kind of way, all of the isms. So we don't want to be in competition. What we want to recognize is that someone can experience racism, ageism, and sexism all at the same time. Now, I come to this conference, I recognize many of you work in aging, and we would never say that we are ageist, right? I've worked in aging for 35 plus years. We don't think of ourselves as ageist. However, our implicit biases about aging drive us toward these feelings and attitudes about people that really can make a difference about how we make decisions. I don't know if anybody's ever taken the implicit association test that Harvard has put out. I have to say, I did take the test, and I did skew a little on the side of appreciating younger pictures, appreciating younger people a little bit more, which sort of surprised me because I thought, well, you know, I've worked in aging for as long as I have, I should be able to pass the test, right? And it's really important. What we understand here is that it's not only that we have these implicit biases, but what I'm really pleased to say is with the research that was conducted and with the interventions that we have found that we can make to change our communication strategies, right? To really think about how we communicate about older people, how we communicate about as we age, our collective roles and responsibilities lead to the collective benefits for all of us. As we start to change that narrative, make people aware of their implicit bias, that starts to reduce the ageism. So I'm kind of excited to be able to share that when we talk today, because I don't want you to walk away and think like, you know, all right, everybody's ageist. What are we going to, you know, what are we going to do? We're going to be able to do things about it. There is a growing body of research, and I would imagine many of you on this call have seen Becca Levy's recent book that she published on aging and ageism, and have seen some of her research. And there are two levels of ageism that she's really discussed when she talks about, or when she, you know, when she presents about ageism. One of them is that individual or internalized ageism. You know, the negative self-perceptions that we have, the jokes that we tell about ourselves, like, oh, I had a senior moment, oh, my back hurts, it must be because I'm getting older. All of the, you know, those types of conversations. And then the structural ageism, right? Those policies and practices or procedures that are in place that maybe staff at a hospital will will take certain actions simply because of someone's chronological age. And what I can say is we know that when we were working through the pandemic, we did see issues come up where chronological age, the number of birthdays you celebrated, informed how we would move forward in practice and care for you, as opposed to your functional age, right? So just think about how diverse we all are as we age, right? So if I asked you all to think of someone who's 72 years old, we will think of so many different types of friends, colleagues, whether they be parents, grandparents. When we ask you to think about that, some people will have chronic conditions, some people will be running races, some people will be working very happily at a hospital, right? So just kind of think about those things and how they start to impact us. Now, this negative self-perception of aging, it harms us, it harms our health. And so we really have to think about things like people will be less likely to seek healthcare because they have a negative attitude towards aging, a negative self-perception of aging. More likely to persist with health risks, right? Because we know you can't teach an old dog new tricks. I've been smoking since I was 15 years old. Well, we do have evidence and research that we can help you quit smoking, right? You're more likely to experience a cardiovascular event, right? Because of the continued exposure to negative stereotypes. And this research is really important for us to think about when we're talking about how healthcare professionals and how the healthcare systems will approach care for older people. We talk a little bit about structural ageism, right? And so what researchers found when they looked at data from more than 6,000 Americans older than 50, they found that 1 in 5 adults experienced ageism in the healthcare setting, right? For people with functional challenges, experiencing ageism was found to make things worse, like the ability to bathe, feed, or get dressed. Other studies have found that healthcare workers' attitudes affect the health outcomes of older people. Now think about that. We approach our care to treat and care for our patients. But if we have those implicit biases about aging and that starts to come through, that's going to impact our patient, our older patient, and we don't even realize it. Another study of medical residents found that their thoughts about older adults are primarily related to death and decline. Now think about that. If we're talking about someone who is relatively active in their community and they're 78 years old and we're thinking about an approach to treatment, if we're only thinking about death and decline, how are we going to approach treatment for that person? So these attitudes, these implicit biases about and attitudes, they can create unnecessary pain, indignity, and it can reinforce what I was just talking about our internalized and our own attitudes towards aging. Dr. Levy also did some research around the costs of ageism in healthcare. And I think what's really important that drives things home for me are that the health costs of negative self-perceptions of aging is estimated to cost us about $33.7 billion in the system, right? The second highest costs are those negative age stereotypes that we all carry when we're working with people. And then the third is the cost for age discrimination, and that's at $11.1 billion. So think about this. Ageism affects our health system and costs us about $63 billion in a year. So think about what we could do with $63 billion if we could figure out ways to decrease that ageism, decrease that implicit bias around aging. So more than 17 million cases of our health conditions, right? The financial costs aren't the only thing that impact us, right? There are human costs. Think about when a costly health condition is attributable to ageism. Think about what that can do because of that structural ageism, that structural implicit bias. Because I would put forth, I'm not sure that people wake up in the morning and say, let's be ageist. The other thing that I think is important is to know that there are interventions, and Joanne talks about intergenerational activities all the time that I know are important. I know that Mike talked about how we can embrace in our communities, which is also very important. And what I would put forth is how we communicate about aging is sort of the foundation to the pillars of age-friendly activities, right? Of the age-friendly ecosystem. Because if we change our systems, but we don't communicate it in a way that the public understands, we know we have bigger challenges and we won't see the supports that we need for those programs. Many of the interventions, the World Health Organization recruited a team of researchers to look at interventions to reduce ageism. This was published in the Journal of the American Public Health Association, right? Many of the interventions targeted college students or graduate students in health-related fields. And so one example is a medical school included information on positive aspects of aging and how students can become aware of their own negative stereotypes that might affect the way they treat older people. So remember, making people aware of their implicit bias is a way to start to get that change to happen. We also learned through these interventions that they actually do work. They don't necessarily have to be very expensive, and that combining both interaction and education is most effective, right? And given what's at stake, and given the fact that these are relatively low-cost interventions, I'd propose that it's worth investing, right? You know, the power of positive thinking, it's more than a cliche. It's so much more than a cliche. We do know that positive self-perception of aging increases lifespan by 7.5 years as compared to those with negative self-perceptions. We also know, and I'm not going to explain this, I think probably Tim would be able to explain it so much more in depth than I would, about the impact of people who carry the biomarkers for Alzheimer's. Those with positive self-perceptions of aging are less likely, are 50% less likely to develop Alzheimer's or related dementias than their counterparts who have negative self-perceptions of aging. This really has impact for all of us, right, when we think about it. So that's why it's time for that fundamental shift in how we think and we act and we communicate about aging. And what we're trying to do with the Reframing Aging Initiative is to really help society understand that impact that ageist communication can have on us, how we can tell more productive, more complete stories about aging, recognizing that as we age, we become much more different, but we also have much more experience and wisdom to share, right? That accumulated wisdom and that accumulated experience to share in our communities is so important as part of our dialogue. We know that the way framing works is if we can change the communication, we can change the discourse, right? We start to have these discussions, meetings like this, what we take back to our colleagues from meetings like this. It starts to impact how we think, it starts to impact how we behave, which ultimately leads to that change in policy and practice that we all seek. So words matter, right? And one of the big reasons that we need to think about this and the challenge that we all have is you say, they think. So in that sense, what I mean is we could be sitting in a room of experts or advocates and we use a term, we might even say the elderly, and we all understand what we mean there. However, those terms, because of how we process so much information so quickly and the models that, those cognitive models that help us just make those split-second decisions. The public thinks of frailty and dependency when we talk about the elderly. Our goal is to get people to recognize that we are all aging, that we have the collective responsibility and drive people to think about the collective benefit when we all work together as a community. And the way that we start to take those actions, really can, and I'll share with you in the chat, some resources and tools that we have about how you can start to change that communication, how you can start to embrace values that we know shift the needle on how the public perceives aging, how the public thinks about aging. And when we want to tie this to how you think about the age-friendly health systems initiative, right? The pathway, the most important piece that we talk about is what matters most, right? What matters most to that patient that we're caring for, along with the other pieces of the framework, right? We have to ask a patient, well, what matters to you? That drives the rest of the way we'll work with our patients, right? And so I would encourage you also, if you haven't, to look at that. I know that that Utah is very active in the 4Ms framework, and I can't highlight how important it is to recognize how our implicit bias about aging and health really can inform how we can be, if we can decrease that implicit bias, it informs how we can do so much more to learn about advancing the 4Ms framework. I have some tools here that are available to get you started if you're thinking about how you can start to change your communications strategies, which include a quick start guide and include some explanation about why we put in the quick start guide what's there. And I would also invite you to take a look at our website, reframingaging.org. We are working with organizations specifically to help change communication strategy, and we'll be happy to speak with you about that if you're interested.